I'm Brenda. I'm one of the care queens from Ode Not a Care. Today we're going to do a short video on how do I pack a nursing bag for working in the field. That's whether you're a hospice nurse, palliative nurse, home health nurse, newer to the field. We've been doing this for a combined years of 45 years, and we've gone through them all. And so we have some tips on how to do the bag. First of all, the goal of the bag is to have it, is it washable? Can I wipe it down and wash it? Does it have a clean side and a dirty side that you can access? You never access your bag in the clean side unless you've sanitized your hands. And does it work for your body? Is it work? I also, with my bag, my personal choice is a backpack. For lots of reasons. One, it has my hands free, helps my posture. I'm not laying my bag around and losing it. Another bag that was popular I used for years is a roller bag. Works really well for people who don't want to lift their bag, but be cautious of always pulling with the same arm because it is hard on the shoulder. Some people like a shoulder bag, cross strap or over the shoulder. Again, it holds a little less, which is okay, and make sure it has a clean side, dirty side. Some companies insist they use their company issue bag, but find what works for you. And also it's important, like your bag, it's gotta be pretty. I keep my mini bag with me, with my backpack on it. I have in my phone, my keys, lip gloss of course, a quick reach of gloves. I keep an extra tape measure, a sanitizer, and some alcohol wipes. And that way I've always got it on me and I can go. So basics of the bag is, so if you have a roller bag that can sit on the floor, great. You don't need a sheet. But you never want to put a shoulder bag or carry bag or backpack on the floor. If you do, you need to have a surfacing. And often I put all my backpack on there anyways, and then I also gives me a place to write little notes if I don't have my computer up and running. So we're going to start with the outside of the bag. For my bag, I like this one, just like the roller one. It has kind of an outside compartment. I call it my mini office. And so I have scissors, bandage scissors, forceps, extra, all the office supplies, highlighters are great because you can highlight when you write out a mark for somebody, follow this, check this, make it simple. Tape, I use tape all the time to tape up that sign that says don't call 911, call hospice. Extra pens, a large eraser, and a mechanical pencil. So as I'm updating their med sheet, I can erase and start over. I care, essential, I have 3 different sizes of sticky notes. So that if I'm pre-filling syringes or I want to identify something, I can stick it on there and then have the tape. I do keep a whiteout thing, not for only official documents. So that all sticks there. For me, this is essential. I like to have my sanitizer on the outside of the bag at all times, so I have easy access. With that, I keep my wipes to wipe down all my equipment after use. And I always keep my gloves on the outside, and so that I have easy access. Also, I keep my bag set up in my car, so every time I go in and out of my car, I can set it there and everything's at access and I can refill my bag. I tend to not carry a lot with me because I find over time, if you have too much, you can't find anything. And if you have to run back to your car even twice, so many steps is better. Okay, so what bag works for you? So we've gone through the outside. Now the inside, you've got your dirty side, your clean side. We're gonna start with the dirty side. Our company wants us to have an algorithm that we keep with us, and it's really good for new nurses. I keep only a couple documentations. I keep instruction sheets that I can write out instructions for families, and they usually have a copy. I can take one with me. But I usually like to write all my instructions out with the computer and print them up. I keep lots of these with me, which are documentation of what PR medications were used. And that documentation sheet matches what's in the care plan. In the care plan, and you can go to our website and find out about it, but that med sheet matches what's in our care plan to document what meds are used. And also by having an extra care plan with you at all times, it's really helpful. You can just pull it out in the moment, have that conversation, whether you're talking about active or transitional dying, or whether you're talking about how the body dies, but it's a great way to have something in your hands to start those really difficult conversations. So that's mostly for the dirty side. Also on the outside, I keep my extra papers and an extra computer charger. With my papers, I also have a great little slot in here, why I like this bag, so that my computer slips right in there, and then everything's contained. Okay, so we're gonna, also in the dirty side, I keep a nail kit. Those are for doing toenails, I keep disposable clippers, files, something to clean all the equipment, and lotion. You wanna get to know your patient, do their toes and fingernails, give them a little massage, you're gonna like Flint. Okay, so I keep that, that's also in my dirty side. Keep that together, and I love, for people who are crafters and organizers, it's kind of fun. Keep that on my dirty side. I have 4 different compartments. Next, my next compartment, which is a clean side, I keep all my stuff for vital signs. Okay, it's all right here, which I include in that, my tape measure for getting measurements for lots of different reasons, and I keep those all together. Okay, so that's also on the clean side. We're gonna put everything in kind of quickly for now. Now, also, I keep a handful of swabs with me. I don't keep a large bag. If I need more, I go to my car where I have them pre-made up. I always keep a 3cc syringe, a 5cc syringe. You want to take that catheter out, it's just right there. Always, I have a large tube of KY jelly, a small packet of KY jelly. Catheter securing devices are super important. I keep 1 or 2 in the car. I also keep a bag full of tampons, the small tampons, and those are for when people come up with nosebleeds, which is not infrequent. They work wonderfully. I don't keep a lot of supplies, dressing supplies with me. I tend to prefer ones that are foam with a border that stick. They can be, they're waterproof, whatever version your company uses, plus paper tape. I also keep, there we go, thank you Nancy. I always keep an extra tube of barrier cream with me. You never have enough. I write the patient's name on it if it's in a facility, leave it at their bedside, whatever, but I always carry extra barrier cream with you. Another, of course, alcohol wipes. That all goes in to the clean side of the bag. The other thing, make sure that you are provided with a magnet to deactivate a defibrillator that hasn't been deactivated. Goes right on, tape it on, leave the family instructions, and there's, of course, 1 ml syringes that we use to pre-fill medications. Make sure that you mark them. That's why I have the tape. Pre-filling really can help. Oh, 2 more favorite items. Every nurse should have this in their hospice bag. It's a headlamp. Try putting a catheter in without help. Dressing change, dark room. It seems silly, but I probably use this more than anything in my bag. And I always keep a carabiner on my bag. I can hook on hair ties, car keys, whatever. So, I hope that has helped. Good luck out in the field.